Hi, my name is Shawnee, and I'll be doing the signs and symptoms, modes of transmission, control and prevention, and host factors for Group 4. Signs and symptoms. The H7N9 bird flu symptoms are similar to those of normal flu. Bird flu illness in people has ranged from mild to severe. Signs and symptoms of bird flu infection in people can include fever, temperature of 100 degrees Fahrenheit or greater, cough, sore throat, runny or stuffy nose, muscle or body aches, fatigue, headaches, eye redness, and difficulty breathing. Other possible symptoms are diarrhea, nausea, and vomiting. Avian influenza A virus infection in people cannot be diagnosed by clinical signs and symptoms alone. Laboratory testing is needed. Avian influenza A virus infection is usually diagnosed by collecting a swab from the nose or throat of a sick person. Modes of transmission. Bird flu viruses can infect people when enough of the virus gets into a person's eyes, nose, or mouth. Transmission of the virus can happen in a few different ways. First is touching a contaminated bird, plain and simple. The second way is when a person touches contaminated feathers, feces, or surfaces that has the virus on it, fails to practice proper hand hygiene, then touches their own mouth, eyes, or nose. The third way is when the virus transfers to the air from various bird movements via droplets or possible dust, and a person inhales the virus if they are in close enough proximity to the bird. According to the World Health Organization in 2017, there is not any evidence that the avian or other zoonotic influenza viruses can infect humans by way of adequately prepared foods. Control and prevention. Since the H7N9 virus is not spreading easily from person to person at this time, the CDC does not recommend that people delay or cancel trips to China. However, travelers to parts of China affected by the H7N9 avian flu should heed to the following cautionary tips. These tips are known as primary prevention methods or activities designed to reduce the occurrence of disease. The best way to prevent infection with the avian influenza A viruses is to avoid sources of exposure. Most human infections with the avian influenza A viruses have occurred following direct or close contact with infected poultry. Therefore, do not touch birds or poultry. Eat only thoroughly cooked poultry and eggs. Observe good personal hygiene, such as washing your hands with soap and warm water before preparing foods and after visiting the toilet. Avoid crowded spaces in contact with people who have fevers and or the flu. Avoid visits to poultry farms and poultry wet markets. Other tips of prevention include secondary prevention methods or intervention designed to reduce the progress of a disease after the agent interacts with the host. See a doctor immediately if you feel sick upon returning from overseas, particularly China. As scientists rush to develop a new vaccine for the H7N9 flu, infected patients are treated with normal influenza antiviral drugs such as Tamiflu and Relenza. While antiviral drugs are most often used to treat influenza, they can also be used to prevent infection in someone who has been exposed to the influenza viruses. Host factors. As with the seasonal flu, everyone can get it, but some people are at high risk of getting very sick from the bird flu infections. These people include pregnant women, people with weakened immune systems, elderly people aged 65 and older, young children below age 5, people with medical conditions such as asthma, heart disease, and chronic lung disease, poultry farm workers, and those who consume raw eggs and undercooked poultry meat.